Perfect. With that, I'm excited to turn things over to Linda and Nancy.
Thank you. It's so nice to be with MHPA. You've got wonderful leadership. You're doing wonderful things. And Linda and I are both very happy to be with you today. Everyone is very excited about the fact that there is now a date for when the public health emergency will end. And so the planning and our discussion today will discuss what is happening with regards to Medicaid beneficiaries. And I know many of you are working on this and have been working on it over the past year as we were all anticipating an end, and we now have a date. So we have different numbers of how many people may be affected by the end of the public health emergency with regard to Medicaid beneficiaries. The Urban Institute has estimated about 18 million beneficiaries. I've heard anywhere from 14 to 18, and that there may be a lot of people that will be disenrolled. But what we want to do today is walk through those types of issues that we know will occur during this time frame, during the 1 year period when the states are starting to take actions. But there is a lot of important people being beneficiaries that are involved in this issue, and a lot of health plan movement and revenue that will change. Next slide, please. So we all know that there will be a timeline for what to do, and the states have been actively having plans together on how they start doing enrollment and eligibility qualifications. Here is one example of how one state will start looking at these issues, but the CMS has told them all to start thinking about how to do this. This timeline talks about the enrollment, when enrollment conditions will expire, terminations may begin, and how states may be qualified in a different way. So these are how it may occur in some state plans and how others are looking at timelines. But it is a lot of work for each state to ensure that every Medicaid person is eligible and every Medicaid person is re-enrolled in their plan. Next slide. Again, the Urban Institute has said that there are about 18 million people. About 3 million in their plan may transition to children's health insurance programs, and the states have somewhat of an obligation to assist in that transition and transition any of the 18 million people to another plan. It's an estimate that at almost 4 million become uninsured, and about 9.5 may transition to employer-sponsored plans. I don't know whether or not that will be the amount, given some of the losses of jobs that have been announced. They may be transitioning to Medicaid, or they may be transitioning into the tax credited marketplace. So those are the 4 options that we believe will be occurring. And there will be a change in the number of those who are enrolled in Medicaid. It may not be less, it may be similar, but they may be different people. Next slide. There are different ways that the states have been given the authority to complete the renewals and do eligibility redeterminations on everyone. One option A that has been outlined is that they begin a 12-month unwinding period in February of 2023, 2 months prior. And then they do it with different patient populations in the Medicaid program. Option B is the states begin 12-month period, 1 month prior to the end of the continuous enrollment. And a third option is you can begin after the end of the continuous enrollment. And different states are doing different things. I've looked at several of the states, and California's is the most detailed. And there are a few states that I have lived in that are not as precise and explicit on how they will be doing it. Next slide. So I'm going to turn it now over to Linda to go through some of the business issues that you all will be facing when the states start doing these activities.
So again, as Nancy said, we're so delighted to be with you today and to talk about this now that we actually all have a date. We've all been working and talking about this for some of us a year, always continuing to watch when the notices came. And then finally, we did get a date and we know the target, and we're all working diligently to get there. I know, as Nancy indicated, all of the states at this point, I think Nancy indicated, all of the states do have their plan, which, you know, they were all to have their plans submitted by February 1st and to have all their system readiness done by February 1st and have all the data ready depending upon when they were starting, either February 8th, March 8th, or April 8th, because in many, if not most of the states, as I understand it, the states are providing data files to the MCOs so that the MCOs will know what groupings of members are coming up in any particular month. As Nancy mentioned, some states are doing more of a risk-based approach so that they're taking cohorts of members most likely to be ineligible first, and other states are taking different kinds of strategies in terms of how they're distributing the groups that will be starting through the process first versus later on in the process. Some states are doing it simply as based on when the members' renewal period comes up, and so all of those things are in the state plan. So it's really important to understand that, how it's set up in the state plan. So of course, one of the things that's important about what is facing the states, frankly, is that the states now are having to, where for this entire period, I'm sorry, my screen kind of got away from me. So over this period, the states have not had to do any of these activities. They haven't had to do renewals, redeterminations, and verifications. But now, starting April 1st, they will be bringing online all of these categories of activity that they have not had to do over the past 2 years. So the renewals, they'll be renewing people based on some sort of prioritization that we talked about. They'll reset up all their redetermination processes that they had, which often happens over the course of a 12-month period. And they will be doing all of the additional verifications as appropriate when they need to verify certain of the eligibility criteria. So all 4 of these categories will be coming back online as of April 1st. And the renewals will be spread out over the course of the year based on the state plan and how they've decided to break up the population. So one of the things to keep in mind is, so many, as I think all of you probably are aware, and as many of us know in working with different MCOs across the country, different health plans are planning different strategies to communicate with beneficiaries. The key here, both from CMS and the MCOs, everyone, the objective is to minimize the loss of coverage for beneficiaries. If a member can continue to be eligible for Medicaid, we all want them to continue in Medicaid. If they do not qualify, we want to get them transitioned to a program of coverage that will be appropriate for them. You know, one of the things that happened in the CCA bill was the extension of CHIP and the protection of the CHIP program as an option for the children who need to transition out of Medicaid. The federal regulations do not prohibit MCOs from doing outreach. The states are planning to provide the MCOs renewal files, and the MCOs can do outreach using phone, text, email, and mail. And the MCOs, many of them are putting processes in place to collect additional contact information to support the state in making sure the state has all the current verified beneficiary contact information. So that's a very important component in this program, because the states are required to be able to validate that they have correct contact information where they have notified the members. So this is going to be, this feedback loop is an important piece for the states in particular. So we've been working with clients throughout many of the states to stand up a process to support members wherein, as a result of the demographic file that the state provides, many of the MCOs will be, in fact, sending outreach communication to the member, in addition to the fact that they would have gotten a packet from the state. And then doing outbound calling to those individuals to assist them with evaluating their eligibility. And if, in fact, it looks like they may still be eligible, being able to, with an authorization from the member, being able to actually assist them with that application process. If they are not likely still eligible, then to help the member understand options for other coverage. For example, with one of our national clients, we are setting up a process where we can actually refer the member back to a marketplace option if it looks like they are not eligible for Medicaid. One of the things that CMS noted in January 25th presentation that they did is that now the marketplace options, they believe, are much more affordable, and that they indicated that 4 out of 5 of the beneficiaries who will be moving out, who no longer be eligible for Medicaid, will be able to find a marketplace option 4 out of 5 times for less than $10 a month. And so CMS is really promoting the fact that marketplace can be a very viable option for people who are no longer eligible for Medicaid. So we know that across the country, there are many states that do have online processing capabilities. And while that is a great thing, it is also true that many of these members who may have, originally gotten qualified through an online application process, it's probably been 2 years since they touched that account. And therefore, they may no longer have their credentials, or credentials may have been reset. And so there is the issue of overload on these online processing capabilities. And so as you're thinking about that, keep in mind that calling in to reset a password could take an extra long time. And so one of the things that we've done to try and mitigate some of those concerns is to make sure we have both an online electronic option as well as a backup paper option, so that you can, in fact, handle either direction, because it's not likely that members are going to want to stay on a phone call holding for an hour to reset a password. So we think that's important, to be thinking about the backup options if the system gets overloaded with people who are trying to do password resets, if in fact they're locked out of an account or don't even know where to find the information to get back into their account. There are many states, you see the states listed here on the side. There are many states that have where the Medicaid application or the CHIP option is automatic in that particular state. these states listed here are not automatic. These states require a manual application for CHIP. And so it's important to know that if CHIP is an option for a child that's no longer eligible for Medicaid, that in these states in particular, that a manual application will be required in order to get them moved over. Pardon me. So just keeping all of those things in mind, we have, of course, set up the processes for electronic signature so that authorizations and documentation can be done electronically to move the process along quickly. One of the things that our process that we've set up with our MCO partners is that we have the data in our workflow system to help us assess for eligibility. And so as we're talking with the member, we'll be able to help assess the member's likelihood of continuing to be eligible. We always, of course, let the member know that we're not the final decision maker. But with that information, then they can make decisions about whether to reapply or whether to look for a marketplace option or a CHIP option if in fact they are or not likely eligible. So that's one of the benefits of our workflow system, that we have all the individual state rules built into our system so that we can assist them with that evaluation process. So one of the things that is unique in this particular period and is not true generally, once a member is terminated, a consumer is not considered a plan member, and different federal marketing rules will apply. However, there is, if your particular state applied for it, there is the opportunity to, if there was sort of an administrative reason for the member not to be able to get their application in, there is a grace period during this time, if it was included in your state plan, to still assist them to get them re-enrolled. But make sure you know what your state plan says about that. One of the exciting things, of course, is January 23rd, the FCC did come out with its latest release on calling and text messaging in order to find ways to continue to support members through this process. And knowing what we do about the way members engage and communicate, this was a welcome opportunity so that in fact we can in fact engage with members in the way in which they're used to communicating. And so the FCC has confirmed that if an enrollee has provided the telephone number on an application, that is considered prior express consent, so that they can be contacted. You clearly always have to have opt-out options and record keeping, but that if in fact the member has provided that phone number, it is considered initial prior express consent. So that guidance from the FCC was extremely valuable and useful as we all undertake to communicate with our members throughout this process. So one of the things to keep in mind is kind of not specifically related to the unwinding, but if we think about Medicaid redeterminations and how it was before the public health emergency and the continuous enrollment, even at that time, we had churn in Medicaid MCOs. We had about 10.3% had gaps in coverage during the periods when they had lost eligibility and were working to regain eligibility. And you can see here that the share of Medicaid enrollees who disenrolled and then re-enrolled and the amount of time that they had lost coverage. So some, like 4.2%, had coverage loss of about 3 months or less. Some, almost 7%, had 6 months of loss. 9% had about 9 months of loss or less approximately, and then almost 10% had a year of loss. And so one thing to keep in mind as we go through this year of really intense recertification processes across the board is to take the learnings that we have this year and apply that as we get back to normalcy next year in 2024, to find ways to, in fact, mitigate the gaps in coverage that members had even pre the pandemic. So while this isn't directly related to this year of activity that we're doing, I guess I just challenge us all to use the opportunity, the outreach, the support of members in getting re-enrolled, to learn how to engage with members in such a way that we can, in fact, try to mitigate these gaps in coverage when we return to what we would consider to be normal churn next year, and try and find ways to mitigate that churn as we return to that state. So I would just encourage us to think about that as we're learning from our activities this year. So I think at this point, we do have a few documents on our website that certainly is available for you in terms of, you know, your planning activities. I'm sure most of you are in the ending stages of your planning activities, a white paper and some different activities that are available there for you. But we'd be happy to take questions, or if there are any questions in the chat, we'd be happy to take them.
And to remind our participants, the buttons at the very bottom of your screen, and we're interested in any thoughts or questions you may have. This is a very time-worthy topic, I would say. It'd be great to have your feedback.
Can I ask Linda a question of you? Are many of the states starting first with the easier populations, like the disability groups, or are they really starting with the MCO type populations in their plans?
I think, I believe many of the states are taking some of the populations like you described, like the disabled, and doing those ex parte, so that they won't even have to do outreach to them. What I've seen most is that states are taking the members they think are most likely ineligible and kind of working through that population first, which somewhat makes sense. Because if they're not eligible, they want to get them moved to a proper coverage category sooner than later. So that's what I've seen most.
So Linda, can you comment on the emergency allotment of SNAP benefits? Are they stopping in March across the board? And thank you for the compliment, by the way. We got a compliment on the outline of the program. Thank you very much.
Thanks. I don't think I can comment on that. I'm happy to check in my information and try and provide an answer back. But unless you have something off the top of your head, I'd hate to give wrong information. So I'd be happy to check on it.
Yeah, and I will as well. I'll do a little. Does the FCC decision apply only to Medicaid coverage or all federal and state health programs?
I believe the press release. Yeah. I believe it's broader. I certainly know that this position of the FCC related to prior express consent is much broader. I do think this particular press release came out in response to HHS Secretary's request asking for clarification. But I think honestly, this press release is a clarification of existing policy, and therefore it would be broader.
And that is my view as well.
We do have this press, if you look up FCC press release, January 23, you'll see the entire press release if you'd like to have access to that.
Yeah, there are conditions in how you must do it and what protections you have to provide, but it is a continuation and a clarification that it will work during this period.
Yeah, very, very useful and valuable guidance there. I know, or at least I believe in, as we've worked with health plans throughout the country, people are always a little cautious about texting and this kind of communication. So I think this clarification is extremely valuable to give us all some comfort in being able to pursue communications in this way. This is the way members are used to communicating with people. So I think it's very useful.
Are all the states required to provide transitional Medicaid assistance during this period, Linda?
Just until they're disenrolled, just until they're
No longer eligible?
until they're no longer eligible.
Great.
That's the way I understand it.
That's the way I understand it. In some of the larger states with larger populations like Texas, California, New York, Illinois, are you seeing any distinction there that may be unique to people on the call? Or are they just systemically going to start the process of redetermination and re-enrollment?
Well, the one thing I have seen in Texas in particular, that Texas is the plan that I noted that is starting with the most likely not eligible. And so some states are doing more of an across the board, just as the member's renewal date comes up. In Texas in particular, they are starting with the most likely ineligible. I believe in Florida, they're starting with like a CHIP population, because I think the thinking is that the children will have another option to go to the CHIP coverage. And so they're wanting to get those people moved as quickly as possible. I do not know of anything unique about in New York or California.
Well, that's very interesting, because when I read the CMS guidance, they suggested even in one of their proposals to do the disability first, because it would be an easier group to just re-enroll.
Right.
And then move to the more difficult. So that's interesting that some states are doing it just the reverse of some of the recommendations of CMS. And I can understand it may take longer to get them moved. It may take longer to get them eligible for other programs. Any other great words of advice that you might offer to the MCO plans?
Well, the only thing I would say, and Nancy, I'd be really interested in your thoughts, but the thing I would say is really be thinking about backup plans, because the states are going to be inundated. I really encourage people to be thinking about what to do if a member has to sit on the phone for an hour, how to create alternatives so that members still get through the process.
Yeah, I agree with that. I have found just in doing routine things with the state Medicaid programs, like change of ownership rules or certain kind of coverage requirements, that some of the states still aren't fully in the office, aren't fully engaged in all these issues on a regular basis. And some of that has become more difficult as there's been quite a different time during the COVID period. So even at the federal level, they're trying to get people back to work in all of our offices as well as in the government. So that may be an issue for everyone to keep their eyes on.
Great.
What specific nuances do you see in Minnesota? Can you do eligibility assessments in the MCO plans in Minnesota?
I see no barriers to doing eligibility reviews there. Again, we never make the final determination, but certainly we have the rules in our system to be able to assess likelihood. So yes, we're able to do eligibility reviews for Minnesota. Just as a summary thought, if anybody, I mean, anybody has any specific questions about your particular state, happy to just talk about it with you. It doesn't have to be anything more than just a general conversation about what you're thinking or what you're wondering. Happy to have those conversations. Just, you know, we're all in this together, so to speak. So happy to talk with you about those things.
Yeah, and given that I work out of Washington, D.C., I think the Medicaid program is the federal Medicaid program that oversees this. They are also very eager and to please and to keep the ball rolling in these areas and are very supportive of state efforts. So it's going to be a hard year, but there are lots of work has been done by states and the federal government to give a clear roadmap.
Great.
But there will be disruption.
Yeah, there will.
It's a lot of people.
Okay, any other questions, folks? You still have time. Just clicking the Q&A button. As Linda mentioned, you can also contact her and Nancy later on. And again, if you're interested in getting the slides, same thing, just shoot them an email. You can reach out to MHPA and we can assist with that. Do you guys have that email on the slide by any chance? If not, folks can just reach out to MHPA. We can help you get the slides.
We do.
Perfect. Yeah. Okay. So take a look at that.
Are there plans for a national media campaign? It's my understanding that there are plans for a national media campaign. The federal government wants to be engaged in helping people get enrolled, and they really want the states to be engaged. I was a little surprised. They used words stronger than be engaged. They use the word require, but they have no enforcement authority, but they want the states to be engaged. But I think the federal government has put a lot more money as discussed into the Navigators program. They are going to be doing a national advertising. I would not doubt at all. And I think they will be very supportive of state efforts.
And I did note on the California website, there's a lot of marketing material that is just free for use for some of those informational campaigns.
Another question. Typically, clients have 30 days to return applications. How should providers produce if patients have provided application, but the state agency has not completed the process? Good question. That's a tough one.
That is a tough one. Certainly, if there is online capability and you have credentials to be able to log on and check, that's certainly an option. Where we are becoming an authorized representative for a member, we will be able to do that kind of checking. Otherwise, it is by phone that those kinds of follow-ups will occur.
Yeah, I think that's
will be
really
tough.
good. Yeah, well, I think that's a really good question for the central office to provide a good answer to, because you know, my view without looking at everything is that if you get it in time, then that should be what matters.
Yeah, they almost like you know, like your tax return has a posted date.
Yes.
Yeah. Great.
Okay, last chance. Well, it's not your last chance because you always email our experts, our speakers here. Okay.
Thank you so much for the opportunity to talk with you.
Yeah, thank you very much. Good luck with everything.
Yep, and thank you both very much. Thank you, Linda and Nancy. That was very informative. You included a lot of great take-home information. And then just one last time, if you're interested in slides, please contact the speakers. You see their contact information there. And join us again next Wednesday for our Webinar Wednesday series from MHPA. And thank you all very much. Have a great afternoon.
Three
Thank you.
cheers to Craig.
Indeed.
Bye.
Bye-bye.